Today in this video, we're going to talk about the best laser for Lichen Planus Pigmentosus. This is the most requested video. Patients often say that just get me off these pigments. Do a surgery or the grafting or a IPL laser or a cosmetic treatment or a chemical peel. Is there a treatment which is effective for LPP? After having used and studied and went into the details and the depths of the lasers across the globe and having patients of LPP across the globe today, across 55 countries, we have the treatments for patients of LPP. Which is the laser which is found to be effective? Whether yes, no. What is the treatment for LPP? We're going to discuss in this particular videos. Let's talk about laser and LPP. Let's understand in this video. Namaste everyone. Welcome to Jyovis Hospital of Ayurveda and Aesthetic Center, Mumbai. Before we understand the treatment, we need to talk about the LPP. Lichen planus was a rare, but today is a very common problem, especially post-COVID, a very common problem. It is definitely a progressive autoimmune skin disorders. Never stops, keeps on going, keeps on spreading. A deadly disease keeps on spreading. LPP, patients are into depression and have stress, and from every place they visit, they get an answer, nothing can be done, cannot be managed. No management, no medicine, no cause. Today we're going to talk about no prevention, no management, but a cure through the oldest, in the ancient medical science, which is Ayurveda. Being an Ayurveda doctor, we see 80% of the OPDs are filled with LPP patients. It's very common in today's time. Lichen planus, different types: hypertrophy, planopilaris, sclerosis, oral, different types of lichen planus. LPP, 80% misdiagnosed. Often patient feels it is because of sunlight, swimming, external causes. No, it is because of the internal causes only. Ayurveda talks about Sankshipta Kriya Yoge Nidan Parivarjana. Rule out the cause. Number one treatment. Number one, very important cause. We see, what do we see? We see number one cause, which is emotional breakdown with self-blaming attitude, a self-blaming pattern. We see emotional breakdown for a minimum of 3 months, continues on and on, going on and on. We see the emotional breakdown pattern 3 more months, and LPP first patch comes in and says hello. So we see it rapidly spreads time by time. Patient is using the tacrolimus cream, patient is using the HCQ, patient has been told to use 5 years, wait and watch. It will go on its own. Been 20-25 years, it's still waiting to go. Patients do wait because after all they hear that there is no cure at all across the globe today. After all the modern technologies and all the new inventions, we see apparently as of now there is no use. And patients often tell us that nothing seems to be effective. At least if I get some 10% benefit, 20% benefit, which Ayurveda offers within just few weeks and months of treatment, so I'll be very much happy. So during this video, we're going to talk about also the effectiveness of laser, effectiveness of the treatment. Let's understand one by one. Patients often tell that after using this, pattern of the chemical peel and the laser and the medications of the HCQ and tacrolimus, somewhere they see no changes, somewhere they see it's rapidly increasing. Patients often demand that please stop my disorder. I don't want it to get healed. It's okay. I have accepted, but at least it should stop because it is a progressive problem for them. Coming to the main point, LPP. First, emotional breakdown. Second, very important reason, we see use of medications. After COVID, rapid cases of lichen planus, all types of lichen planus. Booster dose lichen planus. We see patients after the use of again and again medications. You just need to search on the internet, lichen planus drug eruption. Right from the esomeprazole, the sildenafil, the slimming pills like Orlistat, the sleeping pills like ABC, we see the research talks about the use of medications which leads to LPP. You just got to type lichen planus drug eruption. So toxicity, where we need a Vishagna Chikitsa Ayurvedic toxicology treatment, Agad Tantra treatment, Agad Dravyas, and we see emotional stress where your immune system is so overreactive that it starts attacking the own skin, where we see lichenoid eruptions. So this is somewhere the cause after studying and after seeing and after having a word with specialists and top people across globe about lasers and having my hands on all lasers. We see and having again most of the top end lasers of 23 at Jyovis Hospital of Ayurveda in Mumbai, which is ultimately used for a wide range of skin disorders. We see that Lichen Planus Pigmentosus, there are no lasers. Patients often complain and we see the feedback that after use of laser, it increased. Patients often tell that my body is filled with lichen planus. Which all areas would you put the laser? Patients often also said that after peeling, it reduced, but again it went back same. You need to understand that cause has to be ruled out and the treatment which targets the root is required. We need an immune modulatory action. We need a treatment that is Ushna, Tikshna, Lekhan and Varnya. Over here, I break it down into simple words and explain to my patients across 55 plus countries. I tell these patients that we need to do the weight loss of the skin pigments. Do the weight loss of the skin, Twacha and Lekhan with Ushna Tikshna Dravya. Lekhan, Twacha with Ushna Tikshna Dravya, doing an immune modulatory action. And I don't say prevention management. I use this word getting better, getting better, getting better with a cure for lichen planus. So after seeing the daily miracles, we see how it gets better every 45 days, every 3 months. It's a time-taking process. It's a time-taking process, dedication, determination, discipline, continuation. We see the results. At least 3 to 5 comments on a daily basis, patients say that we used and we followed your video of Karanj and we are daily doing Potli for 15 days, 1 month, 45 days. I see a huge amount of change. Patients tell us that I've seen your video and followed the remedies. I do the Potli, I've seen the results. Patients across the globe get the red rice. Who don't have the red rice, they use the white rice, they dip it into milk, they do the Potli and they've seen after doing 1, 2, 3 and 1, 2, 3 the changes for LPP. So this condition where across the globe we see LPP is incurable. Choose Ayurveda, which is the oldest system of medicine. Touch and cure the root cause, rule out the causes and we see good results. So choose Ayurveda, choose wisely. Choose Ayurveda once you're done with all kinds of treatments. Is there a laser? My advice is lasers are wonderful treatments, very effective medicines, very effective treatments. I use it in my daily practice, but altogether for cases of melasma, skin tightening, skin lightening, and many different cosmetic purposes. There is definitely one treatment which is very effective for LPP. Patients across India, they do come once a month for the treatment, cosmetic treatment, but I first complete a minimum of 3 months of Ayurveda and then we switch to the cosmetic part. Unless we don't build the base of the building, there is no use. Immune modulation and changing the entire composition of the skin is very, very important for us because LPP is not epidermal. It is coming from the fatty tissue. The entire skin is filled with the patches of LPP. So we need to go into the root cause and change the composition. Rasa, Rakta, Mausa, and from the Mausa is the Twacha. So Ayurveda anatomy, Ayurveda physiology and Ayurveda dermatology is very, very important to handle the cases of LPP. This is all for now. Any doubts, questions, write it down in the comment section below. Go through the playlist, go through the playlist of various different disorders that Google and across the globe it is said as incurable. We see cure with no reoccurrence, no relapse at all. This is all for now. Any doubts? We're here. Until next time from Jyovis and the team, look impressive, be progressive.